Alright, so let us begin with Alan's keynote this week. I think it is session number 50, remedy by remedy, and all the related. Okay, so there are a lot of remedies that will work on the hemorrhoids, on the gastric sphere, and if we read them individually in an alphabetical order, it would make less sense because when you read them consecutively or uh, in relation to one another, it will make more sense and more practical usefulness. Just like how Dr. Nash, Eugene Nash, has written his Materia Medica, all the remedies are in the flow of thought of the previous remedy. So that is how we should study the Materia Medica. Farrington's Comparative Materia Medica. He has written all the remedies in a comparison manner. That is how you should study the Materia Medica. So today we'll discuss aesculus and collinsonia from Alan's keynotes. If you have Alan's keynotes with you, if you are watching this on Instagram or YouTube, we are live simultaneously. You can open your Alan's keynotes and read the remedy and some useful tips that I'll be sharing in between. So let us go over and read aesculus hypocastanum. For persons with hemorrhoidal tendencies and who suffer with gastric, bilious and catarrhal troubles. So someone who is always complaining of gastric distress and also has an element of catarrh or nasal discharges should be given these type of remedy, which is mostly good to act in such individuals. Next you have is despondent, gloomy, very irritable, loses temper easily, and gains control slowly. So you have a fine description of what you read in Nux vomica. Someone who loses temper easily, someone who is kind of more, angry on little things. And in such a case, if you are prescribing Nux vomica to such people, you are giving it a palliation, number one. Number two, you are not thinking out of the box. In homeopathy, when you fail in your practice, you need to start thinking out of the box, and that is what is the beauty of homeopathy. You can think of the remedies in an analogy, you can think of the remedies out of box, you can think of the remedies from comparative point of view, you can think of remedies which look like some other remedy but the features are entirely different physically or mentally. And that is what we see over here in aesculus from Allen's keynotes, where there is a mention of the remedy aesculus which has very nice features similar to Nux vomica. He loses temper easily, very irritable, and then gains control slowly. So I don't know how this will be there in the repertory. It will be there in 2-3 different rubrics, but here it's there in a descriptive, beautiful sentence which you can keep in mind and prescribe on those basis. And the patient is miserably cross, and the remedy mentioned in the bracket is chamomilla. So you have a remedy which is, snappish, like chamomilla nux vomica, but has hemorrhoid complaints. He has portal congestion. Think of aesculus. Another keynote what we see for aesculus is fullness in the various parts, as from an undue amount of blood, heart, lungs, stomach, brain, pelvis, skin, all the areas of which are affected as a portal in a portal circulation, and there is fullness and engorgement of the blood in those parts, that will be the indication by the patient. Venous congestion, especially portal and hemorrhoidal, and this will be the patient description that there is inability to feel good, there is constant laziness, drowsiness, or they'll have behavior which is exactly opposite to what normally patients are, which is mild or good natured. That should make you think of venous congestion, portal congestion, and give the remedy aesculus hypocastanum. Next you have is mucous membranes of the mouth, throat, rectum are swollen, they burn, they feel dry and raw. So wherever in the body internal mucous membranes are present, the patient feels that there is lot of rawness, a kind of a dryness, or feeling that there is inability to feel that there is moistness of that part. They will also feel that there is lot of burning in those parts. That is where you should think of aesculus. So when we think of burning, we should think of sulfur. But if a patient is mostly having acute complaints or has more or less these indications of nux vomica like picture and hemorrhoidal complaints, you should think of the remedy aesculus hypoglycemic. Follicular pharyngitis is a very key indication for aesculus. I don't know how many homeopaths prescribe this remedy for throat complaints, but it is one of the remedies which is present in 3 mark in most of the throat complaints in the rubrics which you see in the repertories and in the Materia Medicas as well. So you will see there is violent burning raw sensation in the throat, dryness and roughness of the throat, frequent inclination to swallow. There will be a patient who will constantly tell you that I need to swallow again and again. You will think of giving them Merc-Sol. In the remedy Merc-Sol, I have discussed it extensively that the patient has excess of saliva and he will want to swallow constantly. Or second thing, there is increased discharges, so he will need to go to pass urine frequently. That is the keynote for Merc-Sol as a concomitant. In those cases, you can think of aesculus also if the throat complaints are prominently present and there is burning pains. You think of Merc-Sol in such cases, but if there is burning, think of aesculus, pricking pain, burning pain, stinging, and dryness is there, which is constantly there, and he feels that there is lot of pressure he has to exert all the time to push the saliva from the throat, but he has to swallow because there is no other way out for him. Other remedies given are apis and belladonna, which have their own modalities. You can point it out to the patient to ask, confirm and prescribe. Next you have is coryza, which is thin, watery, burning rawness, sensitive to inhaled cold air. We read this in the remedy Rumex yesterday, and this is what is there in the remedy aesculus as well. Then you have in the rectum, dryness and heat of the rectum. He feels full as if small sticks are there, knife like pain shoot up the rectum. Very fine description of the local pains, physical particulars that the patient will give you. The same expression is there in Ratania also, Ignatia also, and sulfur also. And hemorrhoids in the patient of aesculus are blind, painful, burning, and they are also purple in color and bleed very rarely. Again, whatever we read in the throat complaints, you will see exactly similar presence in the rectum also. For example, there is fullness, there is burning, there is dryness, and there is itching, which is also present in sulfur. There is hard stool, dryness, and difficult to pass. With dryness of the rectum and heat of the rectum, there will be constant feeling that something is burning within in that region. That should be your indication for aesculus. Main thing is that apart from all these things that is mentioned, burning, dryness, roughness, hard stools, there is excessive of backache, which is always there in a lot of aesculus patients. And in this way you can prescribe aesculus. Start with 1 ml or 200 potency, give frequent repetition, taper off after the second or the third day. That is where you should get the result very soon. The swelling, the portal congestion will also reduce. Stool is followed by fullness of the rectum and intense pain in the anus for hours. You see this very strongly present in nitric acid, but in nitric acid it is more of a stitching type of pain. Here there is more of burning type of pain. If you get this sensation from the patient, don't forget to prescribe aesculus in the right way. If it is stitching type of pain, splinter like pains, something which is kind of sticking there, no burning as such, stools are clear or partly expelled, partly not expelled, then you can think of nitric acid. Aloes, ignatia, muriatic acid and sulfur are very closely related, We have covered sulfur, but the other remedies are more or less left, like aloes and muriatic acid, and we'll cover in the upcoming days in the Allen's keynotes study stream. Then you have female reproductive system, where there is prolapsus uteri, and it is also the patient will complain of acrid dark leukorrhea with lumbosacral backache. So this symptom runs through the entire remedy of aesculus, and the patient is also fatigued by walking about. Again, the back pain comes, and lumbosacral articulation is the seat of affection, where there is dull backache, and it affects the hips or the sacral region. And during pregnancy, if these patients complain of backache which is very strong, think of aesculus more than any other remedy. You should first prescribe it, and you will see the indications very easily. It is the dependent parts in the patient where she is lying down. In such a case, give 30 or 200 potency, not too high, because it may cause a very sensitive nature of the pregnant lady to flare up. In such a case, you can go with 30 or 200 potency and space it with 3 times a day or twice a day for 3-4 days, and you will see the result in 3 to 4 days, which is personal experience which I am sharing based upon what I give in to my patients. So whenever the patient is walking or stooping, she has to lie down, and there is this type of lumbosacral backache which is always there in such patients. There is more or less heaviness and lameness in the back, and paralytic feeling in the arms, legs and spine. So there will be complete loss of strength, especially in the lower back or in the legs, which the patient will often complain because the circulation is totally engorged. There is no place for movement for the blood to go and circulate those parts. In those cases, they will complain of fullness and paralytic weakness. Think of aesculus. You have modalities in the end of Allen's keynotes for aesculus, and there is backache and soreness by walking and stooping, inhaling cold air, which is very strong modality again, and motion which aggravates. Aesculus is indicated after collinsonia has improved or partially relieved them. Also, nux vomica and sulfur have been prescribed in all the patients, which most of us will do. We will prescribe nux vomica to an irritable person, but actually it will fail to relieve him or partly relieve him. Think of aesculus. The first few lines of aesculus, which says that the patient is very much despondent, gloomy, irritable, loses temper easily, and gains control slowly, miserably cross, should be your guide to prescribe aesculus in patients who have nux vomica like tendency. But there is nux vomica is more of a spasmodic remedy, and aesculus is more of a portal remedy which will work on the rectal and the portal areas, the liver areas more often. In that case, you can think of aesculus. So we come to an end, and this is about aesculus hypocastanum from Allen's keynotes. If you think of aesculus in such indications which we read out from Allen's keynotes, well and good. Some cases you will have feeling of nux vomica, you will have feelings of muriatic acid, ignatia, aloes, collinsonia. Think of aesculus also in such cases. It's very easy to prescribe. सो डॉक्टर साकेत सिंह, आप क्या बोल रहे हैं ऑन यूट्यूब? सर डिलीवरी के बाद ब्रेस्ट मिल्क इंक्रीज करने के बाद के लिए और बढ़ा हुआ पेट को कम करने के लिए कोई मेडिसिन? यस, सो आई विल टेल यू मे बी इन अपकमिंग सेशंस, बिकॉज नाउ आई एम फोकसिंग ऑन Allen's keynotes mostly. So we read about aesculus and very similar remedy, and only one page remedy which we have in Allen's keynotes similar to aesculus is collinsonia. So when you open collinsonia, there is a very beautiful thing that you will read. One thing is the first line, which says portal congestion resulting in hemorrhoids, chronic painful bleeding pile, sensation as if sticks, sand or gravel had lodged in the rectum, and the other remedy mentioned in bracket is aesculus. So it's a very similar remedy. Aesculus and collinsonia will go hand in hand. But when will you give aesculus? When will you give collinsonia? We'll study that and let us see how you can prescribe. So collinsonia, you should think in cases where there is lot of tenesmus. So the next line, what you read in Allen's keynotes, hemorrhoidal dysentery with tenesmus can be thought one type of indication can be collinsonia. Alternate constipation and diarrhea. Many times patients who have hemorrhoids, they will have this complaint that they have stools, loose stools constantly going on, and sometimes there is constipation for a few days. Think of collinsonia very strongly. If there is constant lumbar backache, think of aesculus. But if there is alternate constipation and diarrhea, think of collinsonia. Congestive inertia of the lower bowel, stools are sluggish and hard with pain and great flatulence, constipation in collinsonia. Next you have is female reproductive system, congestion of pelvic viscera with hemorrhoids, especially in the later months of pregnancy. So early months of pregnancy or middle of the pregnancy, the patients may have lot of other complaints which are of the upper gastrointestinal system. In the second and the third part of the pregnancy, they will have mostly the lower GIT complaints. In those cases, think of collinsonia aesculus, and you will not fail if there is lot of itching in the lady with the hemorrhoids, itching piles. Collinsonia is the best remedy, especially in pregnancy. And if there is also in normal females where there is lot of dysmenorrhea due to pelvic congestion or hemorrhoidal complaints with lot of painful menstruation, think of collinsonia again. Next line what is mentioned is very interesting, and there will be some beautiful case which I will be sharing, which I have experienced in my own internship where I was seeing patients in CMP Homeopathic Medical College. Dropsy from cardiac disease is the first line mentioned in collinsonia in Allen's keynotes. Next you have is palpitation in patients subject to piles and indigestion, heart's action persistently rapid but weak. After heart is relieved, old piles reappear or suppressed menses return. So, I was an intern in CMP college, and I was knowing these remedies and all the other remedies, but there is a lot of confusion in the mind of an intern, in the mind of a homeopath all the time, because there are so much of data which we need to remember and which we need to cross check with all the patients. One of my friend's father suffered a heart attack. He recovered from the heart attack. There was a surgery done, and after few weeks of heart surgery, he was brought home. He developed piles, and he had severe pains. And I was wondering what remedy to give, how to find the best remedy. I consulted one of the professors in CMP college, Dr. Nimesh Shukla, and I asked him, "Sir, one of my friend's father has piles. What is the best remedy we can give? Can you tell me a bit about the case?" He told, and I told that, "Sir, nothing but there is lot of pain, there is lot of swelling in the anal region, and he had a heart surgery, so maybe he is bedridden. That is causing a problem." He told, "Go and give collinsonia 34 times a day, and you will see the result in 1 week." Miraculously, the entire piles, the swelling disappeared, and the patient is still thanking me till date about this cure of piles, which suddenly came up after his heart surgery, and got relieved in a week's time. And this is the cure that homeopaths should give day in and day out in their practice. So you can read this symptom very clearly in Allen's keynotes. After heart is relieved, old piles reappear or suppressed menses return. Although the heart problem was not fully cured, it was bypassed, it was surgery, there was a surgery done, the attack, angioplasty was done and all. But somewhere the heart problem was resolved, but it resulted in congestion elsewhere, and that is the correlation we need to understand and prescribe the remedy collinsonia. So you can see the end of the remedy collinsonia in Allen's keynotes. is for the modalities. The slightest mental emotion or excitement aggravates the symptoms, like the remedy urgentum niticum. So all the patients, now the beauty of Allen's keynotes and the homeopathic materia medica is that all the patients that are very much restless in nature, panicky in nature, they have anxiety, neurosis, they have hemorrhoidal complaints, we are giving them argentum nitricum but are not improving. Think of collinsonia and you will miraculously see that they are improving much faster in such cases. You should firstly know the seat of action of the disease and then you should prescribe the remedy by finding out the exact mentals from the different literature. For example, here you will see aggravation for collinsonia is mentioned for having slightest emotion, mental emotion or excitement which aggravates the symptoms and brings about also the portal congestion and a lot of other things that the patient does which brings portal congestion also. So in such a case, prescribe collinsonia. If argentum nitricum has failed, prescribe collinsonia. Or if aesculus symptoms are not matching and you have another case symptoms of which are similar to aesculus but there is more or less alternate constipation and diarrhea, think of collinsonia. And the case which I shared with of one of my friend whose father had hemorrhoidal complaint after the heart attack, cured by collinsonia, was a miraculous eye opener for me to understand how to pick up different components from the Allen's keynotes and prescribe the medicine in the best possible way to give immediate results. So we come to an end of today's session. You have relations for collinsonia. In heart disease complicated with hemorrhoids, consult collinsonia when cactus digitalis and other remedies fail. So in cases which have progressed with lot of pathologies, in their journey of the disease, there will be heart trouble, there will be liver trouble, there will be varicose veins, then the entire circulation is affected, different places, and we are giving remedy for one main sphere of action, but the patient is also locally affected. Think of these small remedies in for a short while or after every few days, like every 2 days, every 3 days. It is going to relieve the patient. You can keep the constitutional in the background like every day or every 15 days one dose, every monthly one dose. But these small remedies are organ remedies. You can give them on daily basis or every alternate day to keep the organ in tune with what the constitutional remedy is also doing generally, and then you will see the results, good results in fact, on the general level as well as on the physical level. So collinsonia is a remedy which has cured patients after you have given colocynth and nux vomica and they have failed. You can compare collinsonia very strongly with aesculus, aloes, chamomilla, nux vomica, sulfur. So now, like I have been telling in all the previous sessions, whenever you think of an irritable person, you have to match the components, like you do match the following in your school and colleges and your real life. There are few remedies that strike your mind when the patient tells you, but you don't know how to reach that remedy, how to access. In such a case, you should read your source books, read your literature very well. For example, in a case who is very irritable patient, who has lot of portal congestion, lot of hemorrhoidal problems, and is having constipation at times, or at times there is lot of diarrhea, and he has to rush for clearing the stools immediately whenever the desire comes, think of collinsonia. So that's why we have the comparison. Aesculus, aloes, chamomilla, nux vomica and sulfur are the most closest remedies for collinsonia to prescribe, or in such a case where you can think of these remedies, think of collinsonia also and give a thought and prescribe. So that brings us to the end of today's session. We discussed 2 remedies, and in the upcoming days, tomorrow and day after tomorrow, we will take up another set of gastric remedies which will mostly work on gastric spear and are related to aesculus and collinsonia and the other remedies that we'll be discussing in the series of study stream. So that's all for today's session, and if you have any questions like Dr. साकेत सिंह आपने कुछ पूछा है तो इसमें आपके क्वेश्चन का आंसर ये है कि डॉक्टर साकेत सिंह हैज़ आस्क्ड मी दैट what are the medicines that can increase the milk after pregnancy, after delivery, and बढ़ा हुआ पेट को कम करने के लिए कोई मेडिसिन. नंबर वन, बढ़ा हुआ पेट, if the stomach is too, if the abdomen is too large, you can go and tell the patient, number one thing is that exercise is much must after, of course, a good recovery from the pregnancy. Number two, port belliedness of women, top remedy is sepia. Go and read Allen's keynotes, you will find it. But that is not the only remedy. There are many other remedies. Lifestyle change is one of the very important things. And to increase milk, you have the remedies which is asafoetida, agnus castus, lactifluoretum, etc., etc. So those remedies will work very well on increasing the quantity of milk after the delivery is done. And in this way, I hope no other question is there on Instagram and also YouTube. So we'll make a move and see you all tomorrow again 5 p.m. with couple of remedies from the Allen's keynotes, and that's what we come to an end for today's session.